one of us or both of us may have deja vu today. Hi, Shannon DeConda with NamUs. I can't remember if I've recently covered this topic, which is why we may both or one of us have deja vu today. But I'm gonna cover problems addressed, regardless of the place or type of service covered. We're getting inundated still with questions about this topic, so whether covered or not, it bears addressing it again. And we're going to cover it regardless of the type of service, place of service that it's being covered in. And if you want to know exactly where this information is found, if I hold it the correct way, we're on page 14 in your 2023 revisions of 2021 documentation guidelines. And it talks here about the problem addressed. And you'll see that I even have some specific terms highlighted in my copy, and that's going to be exactly what we cover. Now, sometimes questions that are being sent in is, when should I cover a problem addressed? And some of the questions that are being sent in is, when should that diagnosis be utilized? This week, a good NamUs friend of mine, Cheryl, sent in an actual clip of a note, which I'm certainly happy for you to do as long as you do what Cheryl did and make sure you redact the patient information. And what happened with this patient that came in, this was an emergency room patient, and the patient presented, and it states that the patient is comfortably resting. They have no visible distress. The patient has near resolution of chest pain after the patient had a GI cocktail. And it goes along to say that the impression and plan, the patient had acute chest pain, and now the patient has acute gastritis. So the question was, the patient did present to the emergency room with acute chest pain. And we all know that the minute the patient comes into the emergency room with acute chest pain, we go into acute chest pain mode. We also know that on the facility side, when that facility side appending of the code is done, that weighs heavier on the facility side coding, if you're familiar with that side at all. So that's going to impact the level of coding on that side. So Cheryl had a great question, and she's like, so when I'm looking at this episodically, how do I weigh in the chest pain? Well, go back to kind of our 101 coding. 101 coding says when a patient presents with a symptom and the symptom is fundamentally diagnosed into a diagnosis, then we use the diagnosis over the signs or symptoms. And if that is true, and that is how we diagnose a condition, the sign or symptom is alleviated, and we actually use the diagnosis, then we would use the acute gastritis over the chest pain. So in that situation, that would be how we would look at the diagnosis. So we also can always go back to our new rules we have about problems that are addressed and what truly is the problem that is addressed for patients. So if you want to follow along, if you have your documentation guidelines out, a problem is addressed or managed when it is evaluated or treated. And I think that's just a very good catch-all for us to always look at when we're looking at a note in order to evaluate, do we consider this problem to be addressed in our note? Was this specific problem today evaluated and treated? So in Cheryl's note, my first question is, was it a sign or a symptom that was officially diagnosed? My question was yes. Then looking at the acute gastritis, was it a problem that was evaluated and treated? And the answer for that was, of course, yes, that it was the problem that was addressed. So those two reference points just give us a great place to start with every note in looking at sign or symptom, yes or no, Problem addressed, was it evaluated or treated? And that's a great way to know those stepping stones in order to know how to apply those rules. It does go on further when we're looking at notes that have conditions that are treated by other providers. In that same paragraph, it does talk about notations in the patient's medical records of problems that are managed by another provider. If the provider does address them or manage them, that is kind of our point and click, so to say, as to whether we are also going to include those as a problem addressed. So again, we're looking to see if they are impacting our provider's episode of care. It's not just enough for our provider to mention them, they actually have to be addressed and actually impacting the episode of care of our provider. They have to be considered relevant to their treatment plan and how they're taking care of their patient. So again, don't just go while the MDM chart is helpful. It's not the only rules. You really do have to read through the documentation guidelines. And I think that's where we went wrong with 95 and 97. A lot of people relied only on Marshfield guidance and didn't go to 95 and 97 guidelines like they should have. Don't forget the guidelines exist for a reason. If you have questions and we can help, that's what we're here for. Leave your comments, send your questions. Know that we're here through our workshops, through our boot camps. We have lots of training tools and resources to help. And with that, I'll sign off for today. We'll be back with another informative video soon. Thanks and have a wonderful day.